Hi, I'm Dr. Adam Abbs. Today I'm going to give you some general pointers about the remote consultation. First of all, when initiating the consultation, introduce yourself and set the first task. We're used to giving patients time to speak, but at the start the patient doesn't know what to do. So introduce yourself and then tell them that you're going to check a few things, because if you don't, the patient will launch into their presenting complaint. Then, as per GMC guidance, ask for 3 identifiers. Then check their current location, because if there's an emergency, you need to know where to send emergency services to. And check they're in a setting where they can talk privately. It's also useful to ask for a telephone number in case you lose connection. Also ask permission to undertake a video consultation and access their medical records. And don't forget to tell them if you're recording the consultation and make sure they're happy with this. Finally, don't forget to document all these checks. You might want to have a pre-written paragraph to copy and paste into the notes, not least to act as a checklist. So just to summarise, one example of the things you'd be saying would be, "Hi, I'm Dr. Khan. Before we can start, can I check a few things with you? First of all, can you tell me your name, date of birth and first line of your address? Is that where you are now? Are you somewhere you can talk privately? Is there a number I can call you on if we lose connection? And great, are you happy for me to access your medical records and start this video consultation?" The GMC recommends that we check capacity and consent in every remote consultation. So throughout the consultation, you'll be considering if a remote consultation is appropriate for the patient as well. The GMC has a flowchart on their ethical hub that covers this really concisely. The RCGP recommends that if an adult lacks capacity, you must obtain consent from someone with authority to act on their behalf for healthcare decisions, and/or proceed with the consultation on the basis that it's in the patient's best interest to do so, but make sure you document this clearly. Try to assess the identity of everyone in the room, as you would with people who come into your consultation room. If someone is talking for the patient, try to establish why, and try some direct communication. If direct communication fails, make a 3-way communication. Don't exclude the patient, so try to have both the family member and the patient in view at all times. If you have any concerns, such as safeguarding, then ask for the camera to be turned to give you a 360-degree sweep of the room. The start of a remote consultation, when done thoroughly, can feel like an administrative chore. This isn't the kind of the paternalistic relationship that you want with your patient, so change the tone when you switch modes from administrator to doctor. Something like, "Finally, all the paperwork is out of the way, how can I help you today?" would be a nice starter. The patient may be able to hear your hands typing away on the keyboard, but they can't see that you're doing that, so tell them what you're doing at all times. We all know to signpost throughout a consultation, but with remote consultations it's even more important, as the patient might be unfamiliar with this style of consultations. Don't forget ICE. Ideas, concerns and expectations. You'll already know to explore ICE with every single patient, but it's also useful to know to ask them, why now? What made them decide that at this moment they needed to seek help from you? Remote examinations used to be a stopgap between face-to-face consultations. Now they may be the only consultation that the patient has, so make sure you don't forget housekeeping advice, such as smoking and alcohol education. When it comes to closing the consultation, consider the additional risk in not actually being able to touch the patient or take observations. To mitigate this risk, your safety netting must be watertight. The patient needs to know what should prompt them to act, when does your advice apply, where they should go, how they should get there, and then check their understanding. So an example would be, if your temperature is still above 38 degrees in 48 hours from now, go to the emergency department via ambulance. And then, can you repeat that back to me to make sure I've explained it properly? In terms of further communication, in remote consultations you can't give patients a paper leaflet, but you do have a great opportunity to send them emails. So you can send them safety netting and advice via email, you can send them leaflets about their condition from patient.co.uk, for example, or send them website addresses of local self-referral podiatry service, or charities such as Diabetes UK. If you have any concerns that the patient may worsen, or if you're uncertain about the diagnosis, arrange follow-up. Have a low threshold for doing this in conditions that feature rapid decline, such as in COVID-19 around days 6, 7, 8, 9 post-onset of symptoms, or in paediatrics you may wish to do this if you're not certain that parents will seek help as rapidly as you'd like, or for reassurance for you or the parents. Don't forget to use other healthcare professionals for this as well. Health visitors or community paediatric nurses, for example, can come in very useful. And don't forget to share your management plan. Even in a remote consultation, take a moment to discuss the management options and agree this plan with the patient.